Now joining me in studio to discuss the upcoming youth mental health first aid training, mental health first aid coordinators and instructors, Jamie Hagenboo and Tiffany Gager. Hi guys, how are you doing today?
Good, how are you? Thanks for having us.
Yes, good. So tell me a little bit about the purpose and the inspiration behind these first aid trainings.
So Tiffany and I and our organizations have been training with youth mental health first aid and adult and teen for quite a few years, since 2017. And we're seeing an increase, right, of the need for mental health in our areas. And the population we tend to miss the most is parents. So we want to give parents a safe space and caregivers to be able to come and learn some tools on how to better have conversations with their own children, right?
Yeah, and then what can they kind of expect during these trainings? I know you have 2 days, correct? So kind of what can people expect there?
So we have 2 days training, but there is a 2-hour self-paced pre-course, which is really nice because it will be to be completed before the days of training, but they can do it on their own pace. And that's going to already prompt them for all the other tools they're going to learn. So during the days of training, it's going to be really interactive. We're going to talk a lot about how to approach, how to assist, how we can be a support and meet our kids where they're at, right? Try to speak their language. During that time, dinner will be provided. It's going to be on both days. It's going to be at the YMCA, so if anybody has kiddos, they're like, oh, I really want to go, but I got my kiddos, we got you covered. You can come, they can play while you learn how to help not only your kids, but help you too. Being a parent is tough, and self-care is imperative when being a parent or even implementing mental health first aid.
And I feel like recently, you know, like you said, mental health has kind of been on the rise, and there's a lot of organizations kind of doing this and making sure that people can read it and see it, which I think is awesome, so thank you guys. And I wrote this down too, I didn't want to leave anyone out. So you guys have the Shenango Health Network, the Madison County Rural Health Network, and the Norwich YMCA. So kind of, how did you all decide to collaborate on this, all three of you guys, and kind of come together and do this?
So as I said, Tiffany's organization and our organization have been training, and we've been facilitators. So what better way? I live in Norwich and wanted to come together and do this together. And then the YMCA was just perfect, right?
Yeah.
A space to be able to have the kids, like Tiffany said, being able to play and parents not having to worry about where are my kids, they're at home by themselves, you know, it's late at night, and knowing where they are. So it's a space where the kids can play and we can all come together and give the community the much needed tools and reduce stigma, right? If we're all hosting it together, there's no concern about we're all openly talking about mental health and reducing all of the stigma that surrounds it.
Yeah, the Norwich YMCA I think is great. I play volleyball up there, and that is my favorite spot to go. It's beautiful. They have that awesome kids section there in the gym, so I feel like this is a perfect, you know, place to hold this. So what are some of the, you know, signs or maybe symptoms that parents can look for, you know, if your child is maybe struggling with mental health that you guys could share? I
would say for me as a parent, being able to notice if they're disengaging, right? Starting to isolate a little bit more, if their hygiene's changing, their friends groups are changing, and being able to openly have that conversation. I always say that I thought I knew how to best communicate with my kids because I was a mom, but that didn't give me the tools to be able to have that conversation, start that difficult conversation if I am starting to see warning signs that something might be changing, right? And they might be struggling. So it really gives me the tools to identify and be able to have that conversation.
Okay. And a big thing was also getting rid of that stigma, and this is a big part of the trainings that you guys are holding. So kind of how do these help with breaking down that stigma specifically, and kind of what resources can people find?
I would say in our rural communities, and Tiffany and I say this all the time, and I was just saying it to her earlier, is that if parents attend a training, they face the stigma, my child has a problem. When really, you know, if we're attending a training, we're allowing everybody a safe space to be able to have a conversation and better tools to have that conversation with their kids, right? So we're reducing that stigma just by starting and having these conversations.
Yeah, to remove the barriers of saying it's okay not to be okay. It's okay to be broken. There's nothing wrong with being human at any age, you know, and there's nothing wrong with saying, and I don't have children, but I have lived experience. It started as a teen, and it can be really hard for a parent to say, my kid is struggling, because they internalize that, right? We're human and we're fragile, and we deserve love and support and empathy. and breaking that down to start the conversation to say it's okay not to be okay, whether you're a parent caregiver, whether you're a teenager or a youth, and whether it's a whole household. Just starting that conversation could mean a whole new world for somebody and give them the language to say, I'm struggling.